Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, good evening. First, at the outset, I would like to thank the organizers for giving me this opportunity to be a part of the podcast where we are going to speak about understanding with epilepsy. So, I'm Dr. Vaibhav Seth. I'm basically a consultant neurologist. I'm practicing in Calcutta, and today the target for us is to educate the people who are listening to this and will be listening is to understand the myths that we have regarding the epilepsy. So I would like to welcome everyone and thanks to the organizers, those who has given me who has given me the opportunity to be part of this podcast. Thank you very much.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, so they are actually two different things. First is seizure, and the second thing is epilepsy. So what happens in seizure is our brain has got lot of electrical activities. Okay, so when there is an abnormal brain activities or abnormal firing of the brain activities, then we have a condition that is known as seizures. Now, seizures for most of the people occur when you see that there is an abnormal brain firing, and because of the abnormal brain firing, that part of the body starts to move, or what we call as seize. That starts of the body starts to move. So the most dramatic presentation that can frighten anyone of a seizure is a motor seizure. What we say a motor seizure is patient starts to have convulsions, and there can be the violent jerking of limbs, maybe upper limb or lower limb. It leads to turning of face to one side of the body or to the other side. There is blinking of the eyes, and it leads to tongue bite, and there can be involuntary micturition, involuntary passage of urine and stools at time. It can also lead to a very high respiratory rate. At that point of time, the secretions start to come out from the mouth, and the patient remains unconscious for a certain fraction of times, which could be say minutes, right? That is what we actually call a seizure. This is basically the description that I have given to you about the seizures. This is the most dramatic description. If it occurs, the patient or the I mean, if it occurs, the patient attendants or those who are in the surrounding, they can understand that the patient really had a seizure. But sometimes there can be very subtle manifestations. What do I mean by subtle manifestations? Mostly those who are children, they in the children group, the parents get to know from their school that the child is daydreaming. This is the frequent complaint that we get from the school, that the child is daydreaming. It is he is lost in the class. So what suddenly happens is that there is a abnormal brain firing. The brain cells have fired, and as a result of which he became blank. So that can be also a manifestation of seizure. Another manifestation of seizure can be chewing. Someone can do movements like this, which I'm showing like this. This is known as
Yes.
automatism. So these can also be a manifestation of seizure. So there can be a lot of manifestations of seizure actually.
What is epilepsy?
Yeah. So the very first thing that I told you, that the seizures and
Yes.
epilepsy are actually two different terms. We call it epilepsy. Epilepsy is basically a disease. We say epilepsy when a person has a tendency to develop frequent seizures. So you have say one episode of seizure, we don't call that as epilepsy. So those who are audience who are listening to us, many of you can come with a question, sir. 6 months back, or maybe 7 to 8 years back, I had one episode of seizure with high fever. Do I have a chance of developing epilepsy? The answer is actually no, you don't have epilepsy actually. You can develop epilepsy in the future, but for that we need evaluation. But epilepsy is defined as a condition where you have got the increased chance to have unprovoked seizures. Normally, if you have two or more seizures, we consider that you have epilepsy. So, epilepsy is basically a disease that increases the risk of having seizures. So, epilepsy and seizures are not same. You may have just one episode of seizure and you may not have epilepsy.
What are the different types of seizures? And do they affect people differently?
Yes. So I have also just mentioned before. Also, I've
Yes.
given a description about the different type of seizures. Mostly seizures that we consider are mostly grossly into two types. One is the focal seizures, and the other is generalized seizures. The focal seizures are those where the activity arises from one part of the brain. So if it is say arising from the left part of your brain, then you will have symptoms on the right side. So it can be any symptoms you can have. Say a brain part which is involved in your motor function is somehow electrically excited by abnormal excitation. So you will have abnormal motor functions. You will have abnormal jerking of your right side, could be upper part, lower part, could be face. If it is, say, involving a sensory part, then you will have abnormal sensations in your that part of the body. And the dramatic description that I described before, that comes with the generalized seizure. That comes with the generalized seizure. So in that case, what happens is the electrical activity usually generates from one part of the body, and then I mean one part of the brain, and then it generalizes to bilateral brain. So broadly, these are the two broad classification of seizures: focal and generalized. And one more type of seizure I think you should be aware of, that is known as a myoclonic type. What happens is myoclonic is there are sudden jerky movements like this, sudden jerky movements. So you may come with the patients would come with a complaint that mostly due to improper sleep, when they get up in the morning, they start to have jerks. They start to have jerks in the body, which are very transient, lasting for maybe seconds. And it can say a patient is having a toothbrush in his hand, he had a jerk, and the thing fell off from his hand. So these are broadly the types of seizures that you can encounter.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yeah, most of the cases we don't find the cause related to epilepsy. Epilepsy can have actually a lot of causes, ranging from genetic to acquired causes. Acquired causes by mean that something that is not present from your, I mean, childhood. So anything can cause seizures or the epilepsy. We know about few of the causes, like say if you have a head trauma, if there is a head trauma, uh, then certain part of the brain cells they get damaged. If they get damaged, that change ultimately leads to what we call as gliosis. So that gliosis in simple word meaning scar. So if there is a scar, that scar can be a nidus for abnormal electric excitation, and it can give rise to epilepsy. There can be other conditions like infections, mostly worm infection in the brain, which we call as neurocysticercosis. Then we have brain TB. These are the infections that can give rise to seizures. We have tumors that can give rise to seizures. We have stroke, which can give rise to seizures. Elderly people with dementia, they can also have seizures. But in most of the cases, we are unable to find the causes related to seizures. So I mentioned something about the stroke. There are other structural abnormalities of the brain also. Some malformation is there in the brain that can give rise to seizures also.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes. So some of the symptoms I had already given a vivid
Yes,
description.
yes.
Yes. So the dramatic, if there is a dramatic seizure activity, which I described, which we call as something known as the GTCS, also known as generalized tonic clonic convulsions. So if you're having a dramatic seizure activity, most of the caregivers or most of the bystanders will be able to understand. So I'll just repeat the description which I said. You start to have the patient suddenly becomes unresponsive, and there it would be head turning to one particular side. The eyes would uproll in upper direction, and there will be the stiffening of the limbs, and the patient would start to have contractions. That is called as tonic clonic. The contraction would can involve the face, can involve the upper limb, can involve the lower limb. It lasts for say seconds to minutes, and it ends in most of the cases with say a tongue bite, and there is usually passage of urine. So that is the dramatic description of seizure. Apart from that, there can be subtle seizure. There can be just jerking of, say, one side of the body, and the patient is totally conscious. The patient can tell you why my suddenly the hands or the legs are jerking. It can so happen in the, especially in the children. The complaints that can come from the school is the patient, the child is very much absent-minded. He suddenly gets lost. So this is a very important thing for those who are listening to this, especially the mothers and the father of the child. They should know that if they get such sort of a complaint from the school that your child is kind of a daydreaming, then there is a condition known as absence epilepsy, absence seizure, which they should be aware of. And if they get to see such cases, they should immediately consult a doctor.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, so I think it's very good that you raised this question. Uh, what really happens with this thing is that epilepsy, more of a disease now, has now become a stigma. Actually, people start to suffer from this stigma that that since I am having epilepsy, that really creates a lot of problem because of the social taboo that comes with it. I'll tell you what really happens. Those people who have actually epilepsy, they feel very underconfident. They feel very low. They feel very, embarrassed to discuss about this condition with with their caregivers or with their friends, feeling that they will be socially isolated. They will not get jobs, or they will not get certain benefits that they should get in their job, and as a result of which, what they do is they start to hide these conditions. They start to hide this condition. They try to hide the fact that why we should go to a doctor and consult this. And apart from this, there is an age old thinking that is going on, that the patients who have seizures, they are kind of possessed with evil spirits. So this actually creates a lot of social taboo, which is also very much responsible for the seizures and the epilepsy being not treated properly. And we get a lot of patients who are totally untreated with untreated. They don't take any treatment, and they really suffer.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yes, that is very important question to know, that the caregiver should be aware about the triggers of the seizure that can happen. So, since there is an abnormal excitation in the brain, there are certain triggers that can give rise to seizures, of which notable are: if there is a high fever, then you have a chance of getting seizures. If you indulge into substance abuse, like taking too much of alcohol, taking too much of nicotine, these things, they decrease the seizure threshold, and it can give rise to seizures. Apart from that, flashing lights, loud sounds, lack of sleep, stress, all these are factors that can induce seizures. So everyone should be aware of this fact and aware of the triggers so that you can avoid it.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
The lifestyle adjustments that can be very helpful in managing epilepsy would be not missing the drugs. Second, good sleep should be there. You should maintain a very good sleep hygiene. You should be very proper with your food that you take. You should avoid stress. You should be managing a seizure diary, that when you had particular seizures. There are certain type of epilepsies that kind of get triggered with the hormonal changes, like catamenial epilepsy. These are seen in the women. They get certain seizures during their menstruation period or in and around the menstruation. So the hormonal changes also can affect the this thing. There are certain medicines also, certain medicines, certain antibiotics which are not given in the patients with epilepsy. So a patient should be totally aware of the fact. They should be well educated that they are suffering from epilepsy. They are taking the anti-seizure medications. They should, if they are going to some other doctor for any sort of treatment, be it diabetes, fever, pneumonia, they should tell that they are on the anti-seizure medications. So the doctor or the physician whom they are treating, they would be aware of the fact what medicines are to be avoided.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, this is very important question that you have asked. So those who are watching us and those who are listening to this podcast, you should be very well versed with the fact how to take care of the patient who is having epilepsy. From the patient point of view, patient should actually tell their relatives, tell their friends, tell the place where they are actually working that they have a certain disorder, which is the epilepsy, for which they are taking medicine. Now, this epilepsy is just like asthma, diabetes, and hypertension, which can be controlled with the medicine. So, there is no harm and there is no embarrassment in accepting the fact and telling out and open that, yes, I have epilepsy. Second, the patients should have a, what you can have, a Medi Alert card, or in certain countries we have certain thing known as a Medi Alert bracelet, which makes people aware that okay, this patient is suffering from a disorder which can cause him harm. Third, the patient. This is not actually for the patient, this is for the caregivers. The patient who are on anti-seizure medications, we have certain sort of sprays which contains a drug known as midazolam. So this spray, if given to the patients while they have seizures, while the seizure is, the seizure activity is almost over, this spray, if it is given to the patients in their nostrils, that can terminate the seizure activity. Now, why it is important? What happens is once the seizure starts due to the abnormal activity in the brain, this can precipitate another electrical activity. So the ultimately you have to stop this electrical activity getting propagated. So the termination of this electrical activity is very important, and that is achieved by the administration of these benzodiazepine sprays, which is the midazolam sprays, and it is very easy to use. You have to just push the upper, give the spray into the nostril of the patient. Now, these are the things that the patient should communicate to their caregivers. Now, apart from that, what they should know, what to do when the patient is having seizure. You should not panic. Keep the patient in the safe position. If the patient is having seizure, surrounding to that, you have to make the surrounding safe. A patient can have seizure anywhere. So what do you have to do? You have to make the surrounding safe by removing the sharp objects or removing anything that can damage the patient. You should know very well that when the patient is having seizures, there is chances that the secretions can pool up in the mouth. So we make the patient lie down in a safe position so that when the body is jerking on the when the head is jerking, they do not hit any sharp object to cause any injury. They You lie down the patient, turn them into a lateral position, and just wait. The activity will go away. If you have the spray nearby, the midazolam spray, you can give it to the patient. You can give the patient the spray in the nostrils. The seizure will go away. And there are certain myths that goes about that the patient's this thing, the teeth has got clenched. So what patient, most of the people do, is try to bring some sharp objects like spoon, knife, or even just to open the jaw. That is really not advised. You're going to hurt the patient. You're going to hurt the patient. There would be a bad injury. And most of the people, they bring some dirty socks. Like if the patient can sniff a dirty this thing's socks, the seizure activity would go away. So this is a total myth which should not be followed actually.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah. What I would like to tell the audience that epilepsy is not a taboo. It is not a condition which should create any social stigma. So the listeners who are listening to this, you should, I mean, take home message would be, please consult a neurologist, please consult a doctor to get your epilepsy treated. This is a treatable condition. If you take medicines properly, your life would be really good, and there should not be any embarrassment or anything in your workplace or anywhere else to commit the fact that you are suffering from such a disorder.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.